in his class.
Good evening, everyone. Thank you for joining tonight's fifth SIL-Asia webinar. If you need assistance, please use the chat window. And if you're having difficulties configuring your connection, please log out from the session and rejoin again. You may also use your phones or tablets to join by using the webinar ID 686-976-739. And for those attending our webinar for the first time, please be advised that all microphones are muted throughout the meeting. And for comments, please use the chat box. And for questions, please use the questions box. The Q&A will be held after the lecture. Tonight's speaker is Dr. Alvin Marcelo. Dr. Marcelo is a general and trauma surgeon by training. He is the executive director of the Asia eHealth Information Network and the managing director of the Standards and Interoperability Lab for Asia. Dr. Marcelo is certified in the governance of enterprise IT, the Open Group Architecture Framework, Archimate, and COVID-5 implementation. May we now call on our speaker, Dr. Marcelo.
Thank you very much, Cha. Um, I hope that everyone is now able to see my screen. I'm now in Kyoto. I just visited the Kyoto Electronic Health Record Lab managed by Professor Shinji Kobayashi, and very optimistic that we can work out something to add open EHR capability to the Standards and Interoperability Lab for Asia. But tonight, my topic is the Health ICT Governance and Architecture Framework, or HIGAF, which we were able to develop together with the support of the Asian Development Bank and CCNC Solutions. So, the context behind Health ICT Governance and Architecture Framework is the lack of capacity of the health ministries in managing the complex health information system that uh, they need to run. And the context of the HIGAF is that we start with the context of the country, start from where they are, and then introducing the health IT governance framework as we are adopting it in the Asia Pacific, identifying the relevant actors, the governance structure, and the process management that we need to make HIGAF successful in the implementing countries. So let's start with framing the context. And I think I'll be preaching to the choir because most of you are aware of the challenges with health information management in developing countries. But in addition to the challenges that we face with health IT, there is always that hope that digital health or health IT uh, palatable of all is the possibility of digital health positively the opportunity of using digital health for achieving and measuring universal health coverage and sustainable development goals 3. We understand that ICT solutions can empower patients and communities to engage with all levels of the health system, to reduce healthcare costs to families, improve equitable access to quality services, increase accountability and sustainability in health service delivery, and optimizing existing ICT infrastructure and making strategic investments in e-health solutions. We have this belief that if we are able to measure the things that are happening in the health sector digitally, then we would be better poised to govern and manage over the health sector in general for each country. The example from Australia shows that investments with health IT would really result in concrete benefits to the health sector. um, as much as saving 2 billion from the cost of adverse events, from the potential savings of 1.5 billion from the cost of non-collaboration on chronic disease management, and $380 million from the cost of preventable medication errors. Up to 17% of pathology tests have been found to be duplicates. 18% of errors are due to wrong medical information, and 25% of physicians' time spent on getting information. So, indeed, technology can support improvement in the healthcare process. And the real challenge with the health sector, and oftentimes it is unfairly compared to the telecommunications sector, is that there are a lot of complex processes in healthcare. And we cannot just replace principles that are used in manufacturing in toto for use in healthcare. We have to understand that in healthcare, it is difficult to automate human decisions. The health sector as it is very much fragmented, and even if you automate one process, it might bump into problems when it hits another non-automated process. And there's a lot of high volume of patients, often requiring very special type of care. And in as much as we want to standardize the care, it really happens very often that in healthcare you have to customize and specialize and have a bespoke type of care to give for specific patients. So we'd like to move from the siloed system to an integrated system. And we envision that from the 90s, where we started with the Millennium Development Goals and vertical information systems, we can gradually move to the new century with the use of aggregated population data towards directing our initiatives to sustainable development goals, creating a digital health enterprise architecture that will create patient-centric information systems, all while keeping an eye on the challenges of aging, non-communicable diseases, emerging diseases, the increasing demand for social health insurance, and the increasing health expenditure. Health IT needs governance, and without governance, we think that it's probably impossible to create anything useful or functional in the healthcare system. The reason is there's just too many moving parts, many stakeholders, and many components involved in making the health process work. And without good governance, it will be difficult to find somebody who would be orchestrating the health process itself. So governance is a very important input to good healthcare information systems. Um, we all know that other sectors have invested in IT governance a long time ago, such as the uh, air industry, and we are always looking for the time when it will be the turn of the health sector to follow suit. We already know the problems that we face in the health sector. We have the lack of funding, the fragmentation of healthcare processes, the lack of standards, and the lack of regulation. And all of these are creating a setting for us to emphasize the importance of health IT governance for the useful deployment of digital health for the achievement of universal health coverage and sustainable development goals. So governance is an enabler for health ICT because in any healthcare sector, especially, for example, in the Philippines, there's a substantial private sector that also operates. And without governance mechanisms, the private sector will be operating in a fragmented way from the public sector. There will be difficulty in harmonizing the standards to ensure interoperability. It will be difficult to create a fair playing field for both private and public sector. All of these are the roles of governance in enabling health ICT. We all know that we need to start from understanding our stakeholder needs, and from those defining our governance objective, namely uh, defining the benefits that we need to be realized, minimizing our risks, and optimizing our resources. This then helps us define our digital health enterprise goals, which in turn defines our IT related goals and cascades down to the enabler goals. And so this is the one slide where we summarize the health IT governance framework, or what we call as HIGAF. It's basically a set of components in concentric circles, with the outer circles being more foundational compared to the smaller circles in the middle, with leadership and governance as the all-encompassing component, which enables legislation, policy, and compliance, which enables strategy and investment, which in turn enables the stack of infrastructure, standards and interoperability, services and applications, risks, architecture, information, and workforce. So this framework essentially reorganizes the WHO ITU National E-Health Strategy Toolkit framework, which is made up of 7 components, and draws them in a way that emphasizes the key components that need to be in place as prerequisites before other components are installed. And by doing so, the sequence makes it easier for later components to maturate. So if you are familiar with COVID-5 has enablers that inform how to govern ICT systems to achieve health sector goals. In a matter of speaking, if you are aware of the 7 COVID-5 enablers and you contextualize them into healthcare, then you're better off identifying these components and making sure that you have the proper investments for each of these enablers. So we think HIGAF is a response to the country needs. For those of you who were at the AHIN General Meeting in Myanmar last March, this is where we launched the AHIN Mind the Gaps framework, where we encourage the countries to make sure that they have a active governance structure that is adopting a governance framework, that they that this governance structure is socializes a shared health enterprise architecture, that there's good program management within the ministries and even in the private sector to implement standards-based health ICT solutions, and that there should be standards available for use by each stakeholder in the country that will ensure interoperability. So, what is governance in this context? We use the UNDP definition that it is the exercise of political, economic, and administrative authority in the management of countries' affairs at all levels, where governance comprises the complex mechanisms, processes, and institutions through which citizens and groups articulate their interests, mediate their differences, and exercise their legal rights and obligations. We divided the governance into 3 parts: the structure, the actors within that structure, and the processes or the terms of reference of each of those actors in that structure. All of these are informed by the COVID-5 framework and also by the Broadband Commission report on digital health solutions for developing countries. So in terms of the actors in HIGAF, we are using this framework where there are multi-level institutions in any developing countries, starting with your patients at the community level, consulting their clinics, and if they don't, if they are unable to take care of their patients, they refer them to the district hospitals, provincial, and later on to the regional hospitals. But in fact, while there is that known hierarchy, there's also horizontal or lateral relationships that occur with between the health sector and the other sectors such as the Ministry of Interior, the Ministry of Finance, the Ministry of ICT, and the insurance agencies, civil society organizations, and the private vendors. And therefore, we recommend that the countries undergo a stakeholder identification process that starts with identifying stakeholders that have roles in policy making and implementation of health ICT, and then identifying stakeholders that take important decisions in enabling health ICT. And then step three, identifying stakeholders that bring in important resources for health ICT, such as human, financial, technological knowledge. Knowing your actors, you now have at least three governance models to choose from. The Broadband Commission report demonstrates three different models, but by no means are we limited to these three models, but these three models were the ones identified by the Broadband Commission. There's the centralized model by the Ministry of Health. There's the government-wide digital agency mechanism, which is larger than the Ministry of Health, but involves a larger whole-of-government approach. And then there's the dedicated digital health agency mechanism where a special agency for digital health is created by the country. An example of a governance structure in the Philippines is where the National E-Health Steering Committee is composed of the Ministers of Health, ICT, the Insurance Agency, the Ministry of Higher Education, and the University of the Philippines as the academic partner. And then they have a National E-Health Technical Working Group below them. And they have created different experts groups to advise the steering committee on various matters as shown on the slide. Malaysia has a different structure. They're mostly uh, they have a government-wide digital agency mechanism, a national ICT council that engages the different agencies towards the digital the government-wide digital initiative. And there's the MOH is represented in the National ICT Council to the MOH ICT Steering Committee. In terms of process management, we divide the framework in the same way that COVID 5 divides the framework into governance and management. The governance domain evaluates the needs of the stakeholders, and based on this evaluation, sets directions given to the management of digital health in the country. The management group then takes on these directions, creates plans, builds solutions, runs these solutions, and monitors the performance of these solutions, thereby feeding back into the strategic monitoring of the governance domain. And it becomes a closed loop, so to speak. And for those who are familiar with COVID 5, these are the processes that map to the two domains of governance and management. The orange ones are for governance and the green ones are for management. I'll be skipping on some slides to emphasize some of the activities of the HIGA framework, and one of them is the RACI chart, or the Responsible, Accountable, and Consultant Informed chart. Once you've identified the actors and identified their processes or terms of references, it is very important to identify the RACI matrix for each of those processes so that no process is orphaned. It is not orphaned because there is a specific or actor that is assigned to that process. So for each process that we identified and we obtained these processes from COVID 5, we would then ask the countries to identify the responsible, accountable, consulted, informed persons for each of these processes. For example, for EDM01 in COVID 5, which is ensure framework setting and maintenance, the countries would have to identify who is the responsible person for each of that, so forth and so on from to EDM 02, EDM 03, 4, and 5. And by doing so, ensures that there is an entity and a person who is making sure that each of these activities are moving forward. So this HIGA framework was field tested and validated by 9 countries in a workshop held in Singapore last September 13 to 15. And we actually implemented this matrix and asked them to fill it up based on their local context. I already showed you the slide for the governance and for the management. There are 32 processes in the COVID-5 management framework, but we identified 6 most important processes in the management domain, which we think are very important for countries to assign a RACI matrix. If they are unable to assign a responsible person for each of these processes, then we assume that they will have a more difficult time implementing the other 26 processes under the COVID-5 management framework. So these are by no means the only processes involved in management, but these are the strategic processes in the COVID-5 management domain, which if they remain to be orphaned, will make the other 26 processes very difficult to implement for countries adopting HIGAF. Then we ask them to assign a RACI matrix for each of the interoperability building blocks that are needed in the country: a client registry, a facility registry, health worker registry, a terminology service, a health management information system, a shared health record, and interoperability layer. By doing so, by filling up these matrices, the countries have a better understanding of what resources are available or what important components are currently orphaned that needs to be assigned actors. So at the end of the HIGAF exercise, we hope that the countries will be able to come up with their HIGAF repository or artifacts or documents that will help them complete their HIGAF approach to solving their national e-health development plan. So in the end, the HIGAF is a course that we are now offering for a span of 3 days. It is offered specifically for ministries of health in partnership with the other ministries that are helping them with their national e-health development. The course goes through a situational analysis and definition of concepts. It has an interactive session where countries learn from each other, and then together they define their HIGAF vision for their country and craft their way forward by filling up their matrices on governance and management. And so the HIGAF framework is AHID's response to the Mind the Gaps approach. If there are countries that are interested in adopting governance for their national e-health development, their digital health initiatives, we recommend the HIGAF approach, a 3-day course where countries learn from other countries and guide each other using the network effect and hopefully come up with a clear RACI matrix for the important components of their governance and management processes. We now have 11 attendees, and I'll be happy to answer questions if there are any. Because we are using GoToWebinar, we cannot assign mic to all the participants. So if you can just type your questions into the question box, there's a question box below your screen, and we would be able to field your questions and answer them. Oh, Vish, welcome. So how can one enroll for the HIGAF course? Yeah, you can email me And once we have enough countries, at least maybe 5 or 6 countries, we will then compile and consolidate these countries and ask support from a development partner, in which case we will then inform you when the next course will be offered. Yes, Mayak, we got your message. We will keep your, we know we have, we will take note of your interest. Basically, what we plan to do is open up a HIGAF course to interested countries, and we will offer this to a development partner to support. So the way AHID works is we consolidate interests from countries, and then once we have enough interest, maybe for 20 to 30 people, then we go back to the development partners and tell them we now have a set of between 6 to 10 countries, 20 to 30 people who are interested in the course, and we'd like you to support their taking of the course, and we'll make sure that you are informed when the course is available. What will be the cost of this course? To the individual, there should be none, Kalim. The course is actually paid for by the development partner. Now, having said that, it might be possible that in the future, we might be charging people who are not from the ministries of health a certain registration fee which we have not yet determined. So that the I think the quick answer to your question is if you are with the Ministry of Health and you are part of their team, we usually take 2 to 3 people per Ministry of Health, then you should be good. There's no cost to you. But if you want to participate in an existing course being offered to the Ministries of Health, we do not have a price on that yet because we are not selling the course as a matter of fee for course. But definitely, that is something that we should take into consideration once we are unable to obtain the financial support from our development partners. Hi, Dr. Lasanta. What's your plan for health information security in this framework? So, Dr. Lansta, if you look at the COVID-5 framework, let me just display the COVID-5 framework. Managed security is actually part of the align, plan, and organize. So there's a process within COVID-5 that emphasizes the importance of security. So for those who are not yet members of ISACA, which is the Information Systems Audit and Control Association, which is the steward of the COVID-5 framework, you can actually download the whole framework from the ISACA website. And if you get the content on COVID-5 enabling processes, each of these boxes are actually defined in the COVID-5 manual. But it doesn't preclude you from extending it with your country-specific uh, information security frameworks. So it just provides a starting point, so to speak, on information security, but you are free to extend it with other frameworks as needed. From Bikash, okay, let me just go through the questions. We have from Mayank, where will the course be held? The first one was held in Singapore. The next one will be dependent on a host country that's willing to host the course. Number two, a development partner who is willing to finance the course in that country that's willing to host it. So those are the two components that we usually balance when we offer a course. So we've offered courses on TOGAF in Kuala Lumpur, COVID-5 in Manila, TOGAF in Mongolia, and we also had another COVID-5 in Bangkok. So the way this works is we gather the interested countries, and then from the interested countries, we ask them who wants to host this course in their country. We get usually at least one or two countries who raise their hands and say we are willing to host this course in our country. Then we go to our funder and we ask them, we have two countries that have volunteered to host it in their country. The Ministry of Health has volunteered to host it in their country. If the development partner agrees, then we proceed with hosting it in that country. So that's what happened in COVID-5 Manila, COVID-5 Bangkok, TOGAF Mongolia, and TOGAF Kuala Lumpur. In the case of HIGAF, this was conducted in Singapore because of the convenience of access to Singapore and also the convenience to our trainers, which is CC and C Solutions. From Bikesh, how is e-health strategy development process in Philippines, Malaysia in terms of political commitment, stakeholder support, budget, HR? What were the challenges during the e-health strategy development process? So the e-health, I can speak for the Philippines and I can speak tangentially for Malaysia because I am not uh, deep into the way the Malaysians have crafted their e-health strategy. But for the Philippines, we've had an e-health strategy as far back as 2010, but we were exposed to the WHO ITU National E-Health Strategy Toolkit in 2012. So that by 2013, we came up with our revised e-health strategy based on the WHO ITU toolkit. In terms of political commitment, it is very challenging, especially when the ministers are changed every 4 years in the country. But what we have found is that if there is a governance framework, even if the ministers change, the framework is there to stay. And one of the first things we ask the new minister when they get assigned to their position is for them to review the framework and to affirm that the framework is still valid. So far, since we've started COVID-5 in the Philippines, we've had three new ministers of health, and all of them agreed and affirmed the governance framework. So that more or less insulates the National Health Information System from the political changes that are happening. Regarding political commitment, this is usually translated into actual budgets into digital health. We are lucky in the Philippines that our budget in healthcare is increasing. And because of that, the budget for health information systems are also increasing. But more importantly, in the Philippines, because of the adoption of the governance framework where we have the National Health Insurance Agency as a active partner in the governance mechanism, rather than for the MOH to spend for everything, they basically partnered with the health insurance agency, who then started requiring electronic submission of reports as requirements for reimbursement. So rather than the Ministry of Health paying for everything, from the computer to the software to the internet, the health insurance agency started coming up with policies requiring the submission of electronic data in exchange for the reimbursement of the healthcare providers. This really helped in lowering the cost to the Ministry of Health, and also getting the clinics and the hospitals to make their own investments on their health information system so that they can get their reimbursements from the insurance agencies. The challenges are always the constancy of the people working in the field of e-health. We have very young people in our e-health office, and sometimes they get better offers from outside. So when we have a person who transfers jobs and we lose the institutional memory together with that person, and we have to hire new people and start to train them again and explain to them the whole process of governance and management of national e-health. I'm hearing a lot about smart on fire app platforms for EHRs. Will this be included in the HIGA framework? I think so, yes, but not by itself. I think the entrance of Smart on Fire will be because of an understanding of governance and architecture. If there's good governance and there's a good architecture, then I think Smart on Fire will be a very palatable solution for electronic health records in the country. But without governance and architecture, I don't think even the best Smart on Fire app is going to work in any country. So, in as much as I think Smart on Fire is very, very attractive, going straight to Smart on Fire without a good governance foundation and the architectural capability in the country is probably going to fail. So, I think Smart on Fire will do well if there's good governance and there's good architecture that is being embraced by every stakeholder in the country. Yes, I will share the copy of this presentation, Kalim. Are there any other questions on the how can one enroll on the HIGAF course? Please just send me an email and I'll make sure that you're on our mailing list of interested partners in HIGAF. Hearing no other questions, I'd like to thank everyone for spending their time with us tonight. I would like to ask for your pardon if if the lecture is very short because I'm now out of town in Kyoto, and I hope we were able to impart to you the HIGA framework and the course that we will be offering soon. We are in the middle of seeking development partners to support the next uh, set of countries who will undergo HIGAF. My email is alvin.marcelo@gmail.com. Please copy furnish Charis so that she will have a backup copy of your request. Thank you very much, and I hope we can see you in our next call. Please keep in touch through our mailing list, and we will be delivering regular standards and interoperability for Asia lecture and also webinar lectures